To age gracefully, but if we need a little extra help to keep that youthful glow, there is a new business in Monticello ready to step up and help. Here with a fresh look from Lively Aesthetics is owner and nurse practitioner Jennifer Lieb. Jennifer, we're excited to have you.
Thank you for having me.
Okay, so let's talk a little bit about this new business adventure that you're kind of launching in Monticello.
Yeah.
Being a nurse practitioner, did this just kind of happen naturally, and like this was just the next step in your career?
I think so, yeah. So I had worked in plastic surgery for 7 years prior, so I had a lot of hands-on experience with that kind of surgical realm, and then started doing non-surgical at Carle as well. So just kind of needed to tailor a little bit more to my patients, and felt like I could do that easier on my own.
And so now we have Lively Aesthetics there in Monticello. So what kind of services do you provide?
Sure. So I do Botox, I do filler and chemical peels, and then also just medical grade skincare.
Now, you're able to do that because you're a nurse practitioner,
Correct.
right?
Yes.
So what is the difference? I guess an esthetician wouldn't be able to do those kind of services necessarily?
Correct. So it all kind of depends on your licensure and what state you're practicing in. So in the state of Illinois, as a nurse practitioner, I have my full practice authority license, so I can do that independently.
Now, okay, let's talk skincare and all of the fun stuff that you get to do. Because honestly, when you look good, you feel good.
Oh, absolutely.
And it's all about, you know, feeling good.
Yes.
And if you have some insecurities about maybe a line here or a spot there, there is treatment that can help you feel better about those things.
Absolutely. And I think something that happened, especially with COVID and people working from home, is people started looking at their faces more than ever because they're on Zoom, they're on a phone call, they're looking at their face for extended periods of time and saying, oh my gosh, has that always looked like that? Or have I always had that little spot there? And then they start, like, once you see it, you can't unsee it. So then that's when people are like, well, can I do something about that? So that's kind of where I feel like a lot of people now are starting to say, okay, I want to do something about that. I want to feel better about that.
Yes, let's talk about this really quickly before they take this away. Tell me a little bit about what's happening in this picture. What did she have?
Oh, sure, yeah. So this patient had 3 syringes of filler placed, and it wasn't all in one area. It was just kind of scattered throughout, just to kind of help refresh and restore her look. So the
Does she have makeup on all of those pictures?
So in all of the pictures, yes, but the 2-week is, she's at home in the 2-week, so the lighting might be a little bit different on that one, but yeah, she has makeup in all 3.
Okay, so you mentioned how many syringes?
3 syringes.
Is that normal?
That's very confusing, right? Because that sounds like a lot to a lot of people, but 1 syringe of filler is about 1/5 of a teaspoon, so it's just not much, especially when you're scattering it throughout the face to try to restore things. You can add up, you know, a decent amount of syringes and have a very natural look.
Yeah, because I've heard of people getting, what is it, baby Botox or something like that, where it's just like a little bit, just a little dabble in it so that you don't feel like you can't, like, you know, like your
you
face
can still move, exactly, and have expression, absolutely.
Exactly.
Yeah.
Not all, I guess, Botox filler is created the same, right? Because there's different versions or is it just different brands?
So there's definitely different brands. And then I would say with the fillers, there's so many different fillers now on market. So they're all made in a different way. They're manufactured different for different areas. So having an injector that knows the differences between what should be injected where is important, using the right product is important, and patient selection is important.
Okay, let's talk risk. What kind of risk is there when it comes to getting these type of injections?
Absolutely. There's always risk involved with anything that we do with medicine. So, depending on the treatment that you're getting, depends on what risk. Obviously, those risks would be decreased if you go to someone who does a lot of it, who has hands-on training, and who, you know, has a lot of education to back up what they're doing.
Yeah, because then you get on, like, the scary side of TikTok, and you see some lady with their eyebrow.
With the eyelid,
and you're like, oh, no, that would happen to me.
Yes, I usually have to talk people down on that, because if they've seen her, then, of course, they think that's going to happen to them.
However, it is temporary.
It is temporary.
God forbid, were to happen, it is temporary. But it's amazing the technology and the advancements that they've had just to give you a little extra oomph if you're feeling a little sluggish.
Absolutely.
There you go.
Absolutely.
All right. Well, thank you so much for coming.
Yes,
this is exciting.
Thank you for having
welcome
me.
to Monticello and this brand new business. If you want to learn a little bit more about Jennifer and her Lively Aesthetics there in Monticello, we will connect you with her and everything happening because she's on Instagram as well. We'll connect you. SayLiving.tv.